Hey, it's Bram Duffee for Health Communication class. We're in week 6, and I wanted to talk about the assignment and get into the lecture. So this week, we're looking at provider-patient communication. And anytime we're talking about provider, we're talking about the physician usually. But in this case, in this world, we have a lot of mid-level providers that are considered nurse practitioners and physician assistants. And so we include those kinds of folks into the same wrap. And for your assignment this week, much like weeks, I think we're around week 4, I'm going to ask you to dive back into the library to do academic research. And so what we'll be doing this week is I'm going to ask you to look for an academic journal article that works to focus on the communication interaction between providers and patients or the patient's families. So this is a common kind of research that is done in health communication. It's sort of like an umbrella term, if we talk about provider and patient communication, because there's a lot of different nuances that can happen with that and a lot of different methodologies. So this lecture today will be spent talking about some of those methodologies. And so that, and combined with the reading that you got in chapter 5 for this week, are going to help prepare you to select a journal article that you can review. And in reviewing, I want you to be able to talk about the type of research that was conducted and what it was all about and what the research question was, so that we can all get the same benefit of that. So those things are listed in your assignment for week 6 discussion post. But I just want to emphasize that we are using academic journal articles. So that means that it would not be a trade journal or a public relations piece. This is something that would be labeled as a peer-reviewed journal. And I would suggest that the 2 easiest ways for you to do research for this would be to conduct library research, where you go interact with the KSU library and use their search tools to find a journal article that you can get full access to, because you want to be able to look at all of it. The other way is by going to Google Scholar and typing in those same keywords. So you can do it in Google Scholar, or you can go to the KSU library, but either way, the work is to track down an article that's going to work out for us. And the only other thing is that I want to remind you that, of course, it's due Thursday midnight, and that we want to be able to get full points to everybody. So participating in the class conversation by replying to other people is part of that requirement. So that's what we're setting you up to do, and that's part of the plan. So let's look at this lecture that we have for chapter 5, because when it comes to provider-patient communication, this is the interaction that forms the bedrock of patient care, and it significantly impacts treatment outcomes. So let's see what this all entails. It involves the exchange of information between healthcare providers, doctors, nurses, therapists, and their patients. It's just that these exchanges could be verbal, written, nonverbal, or even occur, during treatments or follow-ups. But let's explore the different ways that we can study this. One way that we study this kind of interaction is through patient satisfaction scores. And these were made much more popular because Medicare laws were set up so that this is part of how hospitals and providers are scored. And it's a really effective gauge of, that communication, if they have a satisfaction built into that event. These kinds of scores really just look at things like the quality of communication and help the provider understand that they're able to explain things well or not. But the hospitals that often participate in this use a tool that's called HCA-HPS, HCAHPS. So it stands for Hospital Consumer Assessment of Healthcare Providers and Systems. So it's this commonly used tool to do that. And a low score in the communication with doctors section might indicate a need for improvement in that area, and it could also affect funding. So these patient satisfaction scores are seriously looked at. And so that's one way that we definitely look at how well is our doctor communicating with us. The other thing that we look at is, is the patient complying with the treatment that's put out there? So compliance with the prescription is talking about if the communication was good, then did it result in change? So is the patient now taking the medicine that was prescribed? Is the patient doing the exercise or the diet or whatever is prescribed? These kinds of studies help understand, well, did the communication have its intended effect? The other thing are the impacts that impact the interaction. We can study all of the different factors that impact that interaction. And some things could be things like, looking at patients that have limited English skills, or even if we could look at the patient's, maybe the provider's communication style, or, the way that they care. I can just tell you that I know sounds kind of silly, but I actually think my doctor cares about me. And if I'm honest with you guys, I have to tell you that it's one of the reasons I go to that doctor, because he just does extra stuff. And I've been going there for a long time. I chose him for a number of reasons that were in my my preference. But the thing is that when he sees me, it's pretty common that he knows me by name. He's going to put his hand on my shoulder. He's going to do something to let me know that he cares. And the craziest thing about my doctor is that if I'm seeing the nurse practitioner, he still makes it a point to pop in and say hi, So he sees me on the roster. And so it's those kinds of little things that make a big difference for me. I'm just being honest. So other people have the same experience. They say, my doctor doesn't give a crap, so why should I care? Or my doctor makes me feel this certain way, so I want to, bury my head in the sand. These are the things that happen, and because of that, we have to be able to assess our own communication, and we have to be able to make sure that people are being taken care of. And sometimes it's just set up so that a patient in particular needs a female doctor to feel comfortable, or it needs a doctor that's like them in a certain way to feel comfortable. But that's just how the reality is sometimes for individuals. And so as healthcare providers, we have to do what we can to meet them halfway. I will say that sometimes this comes into a problem in the emergency room, because in the emergency room, there's just one emergency room doctor usually, right? And so if that doctor is not someone they appreciate, it's just too bad. There's no other doctor. And I've seen situations where a doctor has an accent and the patient's racist. I've seen the problems just like I described before, where the doctor is a female and they don't trust the female. I mean, usually these things are things that the patient is, it's like these quirks of the patient, right? And the reality is that we do what we can to make the patient comfortable, but there are certain situations, especially in emergency situations, where you won't have those choices. So it's just the reality, but it's worth talking about and understanding, so that we know that one person can deliver a message and it be understood and adhered to, and someone else can deliver a message and it not work out. And that can happen because, just because of the people, the two come from different cultures, or it could happen because of trust. So it's something that's worth studying, so that we can make sure that at the end of the day, our patients are getting what they need. And so we care about everybody in healthcare, even people who are racist, even people who are sexist, even it doesn't matter. It's our goal to genuinely help everyone. So as part of that process, this is how we get there. is by studying to make sure that our approaches can be as best as they can be. Scientific research is the next one on the list. And when it comes to the scientific research category, I want you to just imagine that you're doing a science experiment. I did a science experiment, I guess junior high was my first science fair. Well, you start out with a theory, like I think that something's a certain way. You design an experiment to test it, and then you collect data. You collect that data for analysis, and then see if what you collected supports what you initially theorized. This is really just how has this kind of scientific matching is really similar to how scientific research works in provider-patient communication. So this research assumes that you can actually measure communication, like something there. And so consider this scenario. Maybe their communication interactions are videotaped, and a researcher tracks how many times a doctor smiles during the conversation. And then, based on that, see if there's any correlation to satisfaction scores. See how that could work. You're counting something. Another thing that's commonly counted is how many times someone says their name, or how many caring statements are made. There's a lot of different ways that could be that you can take the actual communication, which is something that's not normally thought of as something that's scientifically based, and attempt to push scientific analysis on that for better understanding. Another research analysis method is called interpretive research. And interpretive research looks at communication as an ongoing process. It's less about measuring specific behaviors and more about understanding how the communication shapes our social lives. So, for instance, an interpretive researcher might study how a doctor's choice of words impacts the perception of their illness. So they can analyze the interactions between the doctors and patients, and then look for patterns in how in the language, and how exploring those patterns could influence the patient's understanding of their health condition. So let's say a doctor constantly uses technical jargon when discussing a patient's diagnosis. That could make a patient feel overwhelmed or confused, or make them more anxious about their health. And this kind of research can highlight the importance of using simple, clear language when communicating with patients. And in healthcare, we're always research-based. And so if there's something there to make a difference, then this can get backtracked in, right? And so right now, one of the things that I'm doing in healthcare communication is I personally work to do research on paramedics so that I can take that research and try to advocate for a better way of paramedics to communicate with their patients. That's exactly what my research does. And so if I didn't have that research, then I wouldn't be able to say, look, there are these overall themes that show that this would work. Instead, I would be looking at this one-off situation or this one-off patient encounter, and those are not as impactful. They're not as strong. So these are the kinds of methods that we talk about. Next, I want to talk about a mixed methods approach. I think it's important because when you incorporate mixed methods, it sets you up to be able to take the best out of the interpretive and the scientific worlds, because this is something that works to analyze something that's numeric and something that's non-numeric at the same time. So quantitative data is normally number-based, something that can be attached a number to, and qualitative data is something that's going to provide rich description or depth to something that a number can't provide. And commonly in research, we do research to match the goal of the research question to the methodology. So whatever it is that I'm trying to figure out, as a PhD researcher, for example, I may not be an expert in a particular methodology, but what I should be able to do is I should be able to say, okay, based on this research question, this is a methodology we need. And so I can work to become an expert in that methodology myself, or I could work to contact another researcher that does set themselves apart as an expert in that way. And then this is the way that a lot of academic papers are written, because you have a researcher that has a problem they're trying to figure out, and then They don't specialize in the research method, but they do know someone that does, and so they work together to do the study. So if you have a mixed methods approach basically works to combine these two methods so that we can look at a research problem and find a way to analyze that based on behavior that's qualitative and based on numbers that's quantitative. So we're able to see a research question and then these two different things that help us give a view of the whole situation. And in doing so, that helps us be able to look at things sometimes from a higher order level of thinking. The other thing that's important to think about is the triangulation. And really, triangulation is what happens when we look at mixed methods research. In this kind of deal, it's like adding a third evaluative tool. You know how I just kind of made this mark? Yeah. So if you are able to give both like something like survey results and interview findings, then this would be something that would support the research strength. And so triangulation is a tool that enhances that. It shows that you take that mixed methods and apply both sides to that approach. All right, so I want to just review before we finish a quick summary of some of the commonly used methods that we use in communication research. So some of these are review, but qualitative communication research methods, these are non-numerical methods that are used to interpret and understand communication phenomena. So it's like having deep conversations or discussions to understand how people communicate. So qualitative communication involves focus groups, interviews, textual analysis, watching videos to explore the meanings or processes or symbols of the communication. All of that's qualitative. Interpretive research approaches. Interpretive research, this is a methodology that looks at how the person's experience makes sense of their world. So it's about figuring out how does this person experience this. So it involves in-depth interviews and participant observation and analysis of text documents, talking to them or watching them in their everyday life. So someone who's a cancer patient and we're trying to understand that experience, this would be someone that we might look to investigate more with this type of approach. And so now that we've talked about the qualitative and the interpretive research methods, let's look at the comprehensive research approach. Comprehensive research approach is a multifaceted approach that combines different research methodologies to gain a better understanding of the health communication. So it's like using different ways of studying health communication, such as quantitative surveys, qualitative interviews, content analysis, having chats, reading articles. Comprehensive is meaning that you're pulling in as much as you can, or at least a much more a large variety of information to be able to get a good picture of what's happening. There also we have different studies that are based on analysis and micro and macro analysis studies. These are studies that look at the conversation between two people. So if you have a micro analysis, then it's more of a conversation between two people. And if you have a macro analysis, it might be a study that looks at the larger social and cultural context that influence that element. So when we look at an analysis, we can be looking at the same topic from a perspective of just that one interaction, or we could be looking at it from a perspective that draws a bigger picture, right? So it's more like what's happening with this one person versus what's happening with the whole situation in the world with these kinds of things. So that's the micro and macro analytic studies. The other thing to mention is applied linguistics research. Applied linguistics research is an approach that It looks at how language is used in real world settings. So it's like looking at real situations, how doctors talk to each other. It also involves discourse analysis, conversation analysis, sometimes ethnographic methods, and applied linguistics research. When I did this kind of work, I transcribed the interviews that I had so that I could better understand and analyze and do analysis of the work. Sometimes when you transcribe those interviews, it's to look for common themes between the people that you're interviewing, or it's to look at common themes in the topic that's being discussed, or sometimes it's looking at how someone says something. So, for example, I had a great class in graduate school about laughter by Dr. Phil Glenn. I think he's on the East Coast now as a communications professor, but he was able to do a class in laughter. And so just being able, through this applied linguistics research, we looked at transcribing and understanding all the different ways that people laugh and what those things, what meaning can be attached to that. So a lot has been developed in help in communication research, and there's a great deal that connects with health communication. And I want to say that I look forward to looking at your posts to see what journal article you chose, and be able to pull apart and understand what it is that you did for analysis for the provider patient communication research study analysis that you're doing for week 6 regarding chapter 5 and the interaction between providers and patients or their families. All right, I look forward to it.